before the delivery. So the dates, the due dates of first checkup, second checkup, third checkup, fourth checkup, all this will come. If there are high risk factors, the A&M will send the messages regarding any high risk factor. The high risk factors will also come in on her page, and accordingly the protocols and the alerts will go to the A&M that this particular service has to be done. So after this data which comes directly, what happens is the computer, the software generates alerts to the A&M. So what happens, before the due date of the first checkup, the A&M will get an alert that your checkup of this particular ID number, this name is due on this day. Kindly conduct the checkup and please report back the findings by an SMS. So what happens, there is a dynamic system of monitoring and control which happens. A&M knows that this particular thing has to be done, because previously what was happening, the system of ANC tracking system is like you just collate the data from the ground level and send it up. Most of the time, only once in a monthly meeting, people will be talking about the data. Rest of the time, the data will never be used. Here what is happening is that by use of the technology, we are able to have, at any given point of time, you can have a look. I'll just take you straight to Varda and actually show you that at this point of time, say for example, I take up a date and I want a report, say for example, of maternity card. Okay. So you will get the maternity card of all the ladies. Let me take a taluka, this will take too long. Devli. What we have done is we have given to each, instead of hosting it on a, we have a server which is just 50,000 rupees, which I have a district. At all the PHC levels, we have given a static IP address with their username and the password. So they can, PHC level medical officer can access all the data sitting for the meetings. A CO can in his office or her office can see, the DHO in his or her office can see what is the status at any point of time in the district. Just bear with me, it is, rather I should take one day only. Come faster. In the meantime, I will the advantages is like a very simple, it's a simplicity at the heart of the entire system. As you know, the mobile mobile penetration is 20 times higher than the internet. It is a very simple concept. You need a server in a district which cost us only 45 to 50,000 rupees. We have a mobile phone. It is in consonance of the future technology. Interestingly, I don't know, not very many people took interest in India, but in Singapore, we had a newspaper contacting me and finding out, because they are the pioneers in the mobile technology. The syntax is very simple. One of the questions which is generally asked is, for an A&M who's not very highly educated, is it possible for her to send the SMSs? But for this, it's a simple, we have a very simple syntaxes. The simple syntaxes can be stored in her mobile phone. When she has to send an SMS, she has to just change a few numbers. Another thing which has happened with this is that you don't need A&Ms to give you data. The registers are automatically generated. So her work, A&M's work gets reduced. It is a totally web-based, so any point of time, anybody can access the information. It's economical Actually, we are paying only 100 rupees for the mobile bill. We have got into agreement with a service provider, and the service provider is providing us services within 100 rupees, and which is sanctioned by the PIP. There is a real-time data for monitoring. Data is generated via SMS. There is no need for two people to sit down and start feeding the data. Data is directly generated through a SMS. It's an instant communication, and there is no other instrument. Simple mobile phone which are used by the people. You don't need a PDA. You don't need a touch screen based phone. And new data can be easily added. I'll tell you some of the outcomes of this entire thing. The outcome was that if you were to see, Wardha is generally a district which has been good. It has good performance in the health indicators. 2008 was the baseline. After 2008, if you were to see, the MMR has reduced by July. We did a midterm review of the whole program. Is reduced from 90 to 51. IMR is like 30.5 in 2008, and it's been reduced to 17.61. And institutional delivery has increased to 98.05%. This is in a nutshell. It has helped, and in fact, has empowered our ANMs in a big way, because to start with the program, we had a meeting with the ANMs and asked them how you feel about the whole program. Do you feel comfortable dealing with the SMSs? And the very fact after they come back for the meetings and they talk about it, they tell us how happy they feel because their skill are upgraded. They know a new tool. I've been told that there is no net access. The internet is not working, so that is a technical glitch. So I'll just show you I can show you in this some of these. Yeah, just 1 second, sir. I can just show you the maternity card. It is like, the maternity card comes like this. There is a sample report list of all pregnant women. Actually, we can have 15, 16. You can run any queries. You want to know how many MTP took place in the year or in a day. You can find out. These are sample reports, high risk factors. Thank you.
Thank you. Thank you, Gunjan.